How do I recognize pet wound dehiscence? Imagine your pet just had surgery and you're checking on them daily. Suddenly, you notice something isn't quite right. That's when understanding wound dehiscence becomes important. Wound dehiscence means the surgical incision has reopened or separated after it was closed. It's a common issue after surgery but can lead to serious problems if not caught early. First, look for visible signs. If the wound edges are pulling apart or if you see a gap, that's a sign of dehiscence. Sometimes the edges are still close, but there's a small opening or gap. You might see the underlying tissues or even muscles if the wound has opened fully. Check if the stitches are missing or broken. If they look like they've been pulled out or if the skin around the wound looks loose, that's a red flag. Drainage is another clue. If you notice clear fluid, blood, or pus coming from the wound, it could mean the wound is not healing properly. Redness, swelling, or warmth around the area also suggest infection or inflammation, which can cause the wound to break open. Your pet might also show signs of pain when you touch the area, although some pets hide their discomfort. Bleeding from the wound, especially if it's fresh or increasing, is another warning sign. In severe cases, you might see parts of internal tissues or organs protruding through the wound. This is a medical emergency and needs immediate veterinary attention. Usually, wound dehiscence happens within the first week after surgery, but it can occur later if there are problems like infection or too much activity. Many factors can cause dehiscence. Excessive movement or activity puts tension on the wound. Infection weakens the tissue, making it easier for the wound to open. Poor surgical technique or using the wrong suture material can also contribute. Underlying health issues like poor blood flow or chronic diseases can slow healing. Pets that lick or chew at their stitches may pull them out prematurely. To prevent problems, pet owners should check the wound daily, keep the pet from licking or biting it, and follow the veterinarian's instructions for activity restrictions. Using an Elizabethan collar can help keep the pet from interfering with the wound. If you notice any signs of dehiscence, contact your veterinarian right away. Early treatment can prevent infection or more serious complications. Remember, if the wound looks like it's opening, bleeding, or if you see exposed tissues, do not wait. Seek veterinary care immediately. Sometimes, minor separations can be managed with local care, but deep or complete openings often need surgical repair. Keeping a close eye on the surgical site and acting quickly can make a big difference in your pet's recovery and comfort.